Hi, this is Jessica DaMassa, and I am here at Health Datapalooza, and joining me right now, I have Casey Quinlan. She is the mighty mouth of Mighty Casey Media. What does all of this mean, as for those that don't know?
Well, I'll explain it to you. My branding philosophy is that if you can't hide it, hang a flag on it. I call that Miss Mazeppa's rules. If you're familiar with Gypsy, the Sondheim musical, at one point one of the ladies, the dancers, says that if you can't hide it, bump it with a trumpet. She was Miss Mazeppa. So I call it living by Miss Mazeppa's rules. So if I can't hide the fact I talk a lot and I'm really loud, so I just call myself the Mighty Mouth.
And she's at Mighty Casey on Twitter, if you have not already followed her.
And mightycasey.com on the web.
There you go. Okay, so we're going to start with what we can see, which is the QR code. So can we tell me about this and what it all means?
This is my small political protest against the lack of data liquidity in healthcare. To be honest, it only scans about maybe 5% of the time now. It's about 4 years old. And QR code tattoos will do well initially for a little while, but then they degrade. Oh. But it's a political statement. Okay. It's a protest against the lack of data liquidity for patients, particularly in healthcare. And I said, as I was going through my cancer journey in 07, 08, that I would, and even before then, that I would be happy to have a barcode tattooed on my neck if it meant I never had to fill out another health history form on a clipboard again. Oh my God, don't you hate those? And so, but then at some point, I want to say it was late 13. Yeah, it was late 13. All of a sudden I had one of those V8 forehead slap moments when I realized I could do a QR code.
That's awesome.
But then it took me 6 months to find a tattoo artist that would do it because, they just said it wasn't artistically challenging enough. And I'm like, dude, I thought I was paying you. But anyway, so I finally got somebody to do it. And like I said, it scanned really well for the first year or so. Since then, not so much. But it does start a lot of conversations, and that's why I did it.
I like that.
Yes.
Okay, so what do you have to say? What is your political statement?
Well, my political statement is, first of all, free the data so that the patients can use the data that matters to them that is pertaining to their lives. But the real revolution that I would like to start is if you're selling my data, cut me in movement. And that's because the global economy right now is running on data. People can talk about manufacturing all they want. Yes, people are still manufacturing things. But data is what drives the global economy. And the data that is being created not by the companies, it's being created by the citizens. But the citizens aren't being cut in on all of that moolah. And I cannot remember whose presentation it was that said, somebody said that that health data is the most valuable on the black market. I can't remember which speaker it was who said that. But that is true. I mean, it's about 5 times more valuable even than your banking data.
Right.
So my thing is, if all of this money is being mined by, data de-identified, go Google LaTanya Sweeney for how much of a big lie de-identification is. Anyway, but, that's being de-identified and sold out of our purchasing patterns at the pharmacy, out of our electronic health records, everything from, Epic to whoever. They're de-identifying and selling the data. Well, why don't I get my piece if that's my data? And I'm not saying all the money.
No.
I mean, for good grief's sake, I'm trying to keep it clean. You could cut me in by giving me an Amazon card every month for $100. I mean, it'd be something.
Oh, you get that for your steps, depending on what health plan you're on. Why not get that for your
Well, that's true. And but the thing is that I don't even get a chance at that because I've been a gunslinger solo since 1/1/89. I've been freelance since 1/1/89. I don't have an employer plan. I have an employer plan. What's that? Yeah. Anyway, so job. What's that? But it's people need to feel more agency and more control, and that's one of the ways that you could really incent people both to contribute their data, not just contribute it for commerce, but also contribute it for clinical research, clinical studies. Because I write for for a company that does, clinical trial recruitment, and that's one of the gigs I have. But I do a lot of writing about science and health literacy, and that's so key, is to feel that agency and that sense of ownership.
I want to ask you, because everybody does have their health data, and this is a good point that you have. Why don't you think
they have it, but they
don't have it? Well, they're creating it. Let's say
Yes.
that. So why aren't more people jumping on this bandwagon of like, you know what? I want my data. What do you think it is about like the general body of American health consumers where this is not a priority?
I will tell you exactly what it is. It's because the system makes it so difficult to do anything, get an appointment, navigate a diagnosis, figure out what's going on, deal with a chronic condition if you end up getting one. It's really like a toxic game of gotcha or some kind of weird, game show where you win if you don't actually have to ever interact with the healthcare system. And that's a problem because that guarantees we continue with this sick care model that we have. It's not a healthcare system. Mm-hmm. And it's only when people, and even in the zone of health policy wonks and, brainiacs and doctors and whatever, it's like they have to have a patient experience of their own. And then all of a sudden it's like they got the memo. And it's like, well, dude, why is it so hard? Why do you have to go and find out how screwed up it is? Why can't you just know that and fix it? So that's sort of a statement directly to anyone who's listening. Just fix it.
I love that. Okay, so I don't really know where to go from here.
Yeah, I'm good at hijacking conversations.
No. I'm bringing it back here. So here's the thing. So I just saw, just recently actually on Twitter, Seema Verma was posting on there that she feels like every patient should be able to walk out of the doctor's office with their health data electronically. How far away do you think we are from that, realistically speaking?
Very far, largely because most of the people out there in the world, out there in people world, either can't figure out how to use the healthcare system. So that's way downstream for them to try to figure out, what do I do with my data?
Yeah.
I mean, I don't even know who my doctor is, she said. I mean, I do, but that's not me talking. Anyway, but I don't even know how to get to a doctor, or I can't afford insurance, so I never go to the doctor. Or, I have a really crummy plan, and then one doctor that I can see has fired me because they call me a drug seeker, because I have a chronic pain issue that no one can address. I mean, there's just so many pieces, so many blockades before anybody even gets to the point where they realize that their data is important to them.
Yeah.
I mean, they haven't even figured out how to get the care they need, much less get hold of the data related to that care. So we got to go way upstream. We're too far downstream in too many of the conversations that we have in these rooms.
Yeah. Tell me what you think about what's next. So we're talking to everybody, WTF Health is what we're talking about. What's the future? So what do you think is next? I mean, long term, do you think this is ever something that's going to get resolved? I mean, it's got to, right?
Well, one of the ways that I have been advocating for a resolution here is to go far, far, far upstream and start teaching in K through 12 syllabus, teaching children both how their bodies work in very specific ways and strapping that to how to interact with the healthcare system, how to talk to a doctor, how to talk to a nurse, how to describe if something hurts, and how to advocate for yourself, how to tell if there's something wrong, how to feel compassion toward your friend, your new friend in the first grade who has a glucose pump because they're type 1. And there's just ways that you can do this. I've written about this a few times for, among other places, the Society for Participatory Medicine. But I think that if we start with kids and start teaching them how to be proactive on their own behalf, toward and in the healthcare system, we might start to remediate some of this.
That's a great, interesting concept. It's teaching health literacy at the same time of literacy
to children, and also it teaches them science and biology and compassion, and I mean, it's awesome. We could do this in K through 12, and we might solve a lot of problems. Let's get those Parkland kids on this.
All right, Casey, if people want to hear more from you, I understand you have a new podcast out, so plug it for me.
Yes, I do. It's Healthcare is Hilarious, and it's on Patreon and SoundCloud.
Okay.
And, if anybody wants to drop anything in the tip jar at Patreon, thank you in advance. But it's maximum length of an episode is going to be 20 minutes. Who has time? And it's my comic take on headlines that attract my attention, particularly around healthcare costs and just system brokenness. And I'm going to have guests.
Oh, okay.
I'm promoting. I'm going to have Victor Montori, Wendell Potter.
Ooh.
woo. And of course, e-patient Dave, and I just hit up Niall. So yeah,
Perfect.
basically anybody, hit me up, at Mighty Casey on Twitter. You want to be on Healthcare is hilarious? Just send me a tweet.
I love it. Casey, thank you so much. It's always a pleasure to see you and a pleasure to hear what you're working on. Thank you so much. This is Jessica DaMassa, WTF Health, here at Health Datapalooza. Thanks.